Hi everyone, welcome back to another episode of One Meal a Day Modified. Oh, yeah, I can get down there. I can also get way up there in the trees. But today I'm just doing basically a short video. Why? Because we are super busy with our business, thank God. It's always busy with the business, but it's so much more exciting in the summer because everyone is scrambling and scraping for something. And it's like working, 18 hours a day, but when you're doing it for yourself and your family and it's to grow your own family business, it's amazing. So, what am I going to talk about today? A couple things. One of them being supplements, aka vitamins. They come in various forms. Obviously, the best way to get your vitamins and minerals are from your food. But if you're lacking, or if you simply need more, because, for example, we live here in New England, vitamin D deficiency is the number one vitamin deficiency among any demographic of people in the East. Because we cover up. It gets cold. As a matter of fact, in the summertime, sometimes people will be like, I'm cold. And you're like, dude, it's 90 degrees outside. You can't be cold. But then you come into a house and it's like 67 degrees because of the central air conditioning is blazing. Yeah, we're kind of guilty of that. So people stay covered up. We go outside. Well, we do anyway, not everyone, but we go outside, but still, we're trying to catch up on all of the vitamin D we're missing from all of the other seasons. So, even though we're getting some vitamin D from our food, of course, in many cases, we require more. Plus, today, it's relatively rainy here. Today, I want to say it rained 4 times, and I'm talking crazy rain. You can't even really go out there and enjoy it. And unlike down south, when I would go to Alabama's for the summer and spend them with my beautiful grandma, it was so warm in the rain that we would actually go out in the rain and play. So you're not doing that up here because our rains are kind of cold. But anyway, so first of all, let me tell you what we're eating today. So today's meal is what I'm calling my cornucopia salad. These are all the things that are thriving right now in home gardens and, of course, the grocery store. We shop mostly at Trader Joe's, Whole Foods. One of our favorite stores actually it didn't go out of business. They closed their location because another store outbid them for the rent in that location. But for us to go to that store, we now have to go 3 highways away. And it's a bit far. So anyway, here I have tomato, cucumber, broccoli, onion, jalapeno. I have a little bit of cauliflower, and then I used a lot of fresh herbs. So I used basil, parsley, and I actually used 2 basils. One, I don't know if it's an American basil, that's what I'm going to call it, and the other one is a Vietnamese basil. And then I actually used some garlic in there, 2 types of vinegar, lemon and lime, and olive oil, a little bit of sea salt, a little bit of black pepper. There you have it. That's what this is. So that's a pretty big serving, but yes, I eat 1 meal a day. This is my meal for the day. Also, what I have here is something rather different. And I'm saying that because I've never had it before, but I decided, try something different. So this is scallops with mushrooms. and it has an Entomel cheese sauce, which is something I purchased from Trader Joe's. Obviously, unfortunately, this is not a sponsored video, but I will show you the packet. This is what it looks like. And it's actually a product of France. So you can see that there. And the cool thing is you can pronounce everything that's in it. Those are the only pre-made foods I will purchase. Now you may ask, why does yours look like this? Mine looks like this because in the photograph, underneath the mushrooms and scallops, and there's actually anamame beans in here as well, they actually have pasta. They suggest that you can serve this on top of pasta or rice. I am not having pasta or rice today, so I'm just having this, as it is. And what I added to it was some more basil. I don't know if there's basil in it, but I added basil. I added a little more cheese. I actually pulverized some cauliflower, and that's what you see on top, the whiteness. And then I added some ground or crushed red pepper as well as a little bit of black pepper. So it's really tasty. It is really good. Just follow the instructions on the packet. Super easy to make. And it's actually pretty satisfying and pretty loaded with scallops. It actually doesn't have as much mushroom in it as I expected. So let's talk about supplements. These are the supplements that I take. I take 2 of these by choice. One that I take by choice is the large yellowish looking supplement, which is omega-3, because I just feel as if, to have heart health, you need more of that in your diet. And since we eat, only so much fish due to mercury fears and stuff like that, pollution in the ocean, plastics, etc., even in fresh water, doesn't matter where it came from, that's why I supplement with this. The other one, which is a large and kind of tan, is just a multivitamin. Almost everyone in the United States or in the world probably should be taking a multivitamin. And then the 2 that I take because I do have a deficiency is the vitamin D and the pink one, which is a vitamin B. I don't know why I suddenly became deficient in vitamin B, but according to my doctor and my last test, I was. So I'm taking this, we'll see what happens. Don't know if it's something I'll take long term or whatever, but I go back in a couple of months to, get my a checkup. So when I get that, we'll see what my levels are at that point. And obviously the levels should be higher because I'm taking a supplement, but for whatever reason, I wasn't getting enough from my food. So that's one of the things I've been paying attention to, and of course, trying to overload with veg, especially, that would be high in that. Isn't vitamin B, I have to look this up. It may be something that you get from protein, but I'm not sure about that. Don't quote me. Like I said, I have to do some research. If so, it makes sense that I would be lower in vitamin B because I definitely drastically reduce the amount of protein that I was taking in at that time. Since then, I've increased my protein some. So, with this meal, I don't think it's the highest protein meal, but hey, there's cheese, there's scallops in there. That's definitely not hurting. So yes, one of the things you need to do is, especially if you're making lifestyle changes or if you simply want to monitor your health, if you're deciding that you want to sign up for, let's say, one of those weight loss programs, I suggest that you not do that. I suggest that you go directly to your medical professional and see what you're doing that needs adjusting. And also, if you're trying to lose weight, why not start there versus doing anything else that's alternative? And the reason I say that is because, one, your medical insurance probably will cover it. They love preventative care. Number two, you're dealing with someone that you've dealt with for your medical issues, for hopefully years. If not, at least they're professionals, and you have an option of, switching about if you don't like the service they're providing. The other thing is with the other, programs and different types of methods they have for people to try to lose weight, usually they never, ever work. Okay, people lose weight, but then they gain it back plus more, regardless of what they do. But if you're working with a real doctor and someone that can give you sound medical advice, someone that can refer you to an actual licensed and certified, educated dietitian versus someone who claims they're a dietitian, you're going to be way more successful for life versus for the immediacy. As well as the fact that, they have all of your medical records. So if something is going to hurt you or harm you or make you less healthy, they're going to be able to look at that entire record and look for red flags. So, if I was not working with my actual real doctor versus going to a clinic or some quick fix kind of situation, I don't think I would know that I was deficient in vitamin B. So please take care. Enjoy your day. Stay dry. We're having like a mini tornado out here. And remember that health is what? Wealth. Health is wealth. Enjoy. Have a good day.